Hi there, I'm Infinity. I'm one of the physical therapists here at the clinic. What's your name? Nice to meet you. Okay, so tell me about why you're here today. Okay. So some tension in your neck and your shoulder blades. All right. And tell me about the kind of work that you do. And does that involve sitting down a lot? Yeah. How many hours a day on average would you say you spend seated? Wow. Okay. And do you also type or use the phone in a day? Do you write a lot? Are you right-handed or left-handed? Okay. All right. And can you describe to me the type of pain that you're experiencing and show me where it is in your body? Okay. It's just here and in the back. Okay. Where is it the worst? Okay. And on a scale of 1 to 10, how would you describe your pain? 1 being not painful at all, and 10 being excruciatingly painful. Or 5. Okay. Alright, so what you're explaining to me today is nothing out of the ordinary. A lot of jobs that require sitting a lot do come with some downsides and make our muscles and bones and skeleton misbehave a little bit because we put pressure on them in an unequal way. Okay, so what I can do today is examine you a little bit. We'll have a preliminary diagnosis where I think we can get a very good idea of what's going on, but we'll know for sure when we continue with the treatments, depending on how you respond to the treatments. Once I've examined you, I'm going to show you some stretches that you can do at home, and I'll also do some manual therapy on you today. Have you had manual therapy before in physiotherapy? Okay, so manual therapy is basically just a massage, kind of. So I'll manipulate some of your muscles and your joints and try to apply some pressure on them in beneficial ways and therapeutic ways for you, okay? So it's a way to realign some places that aren't aligned at the moment and bring some blood flow to areas that are not receiving enough. And some of the exercises you'll need to come back and do with me, so we'll have a treatment plan together for you, and some of the exercises I'll ask you to do at home as well. Okay? Perfect. So the first thing I want to do is just ask you, is there anything else that you want to complain to me about that it might be happening that you haven't told me yet, just so I can get a complete picture of what's going on? Alright, is that when you're running or walking? Relatively all the time, okay. And it's just a shortness of breath. Alright, so let me just listen to your chest and see what's going on, and we'll take it from there. If you could just unbutton your shirt for me. Is that okay? Great, thank you. Yeah, till here is perfectly fine. I just need access to your chest. Great, so I'm going to move in a bit closer and ask you to breathe in, please, through your nose. Keep your mouth closed. And breathe out through your mouth. Okay? Once again on this side, breathe in and out. Okay? And down here, please. And out. Okay, one more time. Breathe in and out. Okay, so in terms of your breathing, I don't hear anything out of the ordinary at all. In terms of your lungs, I think what might be happening is when we put pressure on our skeletons and muscles, what might happen is that tension and the tenseness that comes with it can cause a feeling that your chest is not inflating properly, okay? So it's nothing to worry about in terms of your lungs, but what we do want to do is just make sure that we're able to relax some of your chest muscles. Now what I also want to do is just examine your posture right here So if you just sit how you normally sit, I've noticed you're crossing your legs today. Is that quite normal for you? Okay. And if you can just drop your arms on the side of your body, please, and just keep them dangling down normally. Okay, what I'm looking for is the direction in which your knuckles are facing. So sometimes when we round our shoulders forward and our chest too much, our knuckles can be facing forward and it shows as the wrong posture. You don't have that going on, but what I have noticed is you keep your shoulders up quite a lot and they're quite tense. Do you mind if I just place my hands on your shoulders right here? Thank you. And when I press down, just breathe out. Do you feel that? Yeah. This is the alignment where your shoulders should be, okay? So when you're sitting, what you want to do is make sure that when you're typing and you're doing other things, your shoulders don't come up too much. And some of my patients actually set an alarm on the phone during the workday to make sure that they remind themselves to lower their shoulders down, okay? One exercise you can do to help yourself do that is just shrug as much as you can and release very abruptly. Let's try that together, okay? All the way up and release. That helps our muscles realign and all the way down, okay? And it presses our shoulder down, which is really good for them, okay? All right. So I've noticed you have a bit of stiffness. If I can just feel that again. A bit of stiffness in your shoulders and neck. And that can cause pain in the upper back, in the back of your neck, your shoulder blades, and in the rear shoulder muscles, okay, around this area. So some exercises we can do for that are to lengthen your neck, to tuck in your chin a little bit, stretch your chest, and we can do that today in manual therapy, and I can show you as well how you can do that at home, okay? Now, when you speak on the phone at work or in your day-to-day, do you find yourself cradling your phone between your head and your neck and your shoulder? Yeah? Okay, so you may want to stop doing that. What that can cause is the shortening of the neck muscles on one side, because we tend to do that on one side and not the other. We get comfortable. Yeah? I suspected it might be the case. Exactly. So it can put some pressure on this side and weaken the muscles on that side and then cause some misalignment in your back. Yeah. And that's the side where you feel the shoulder blade the worst? Yeah, that can happen. So we'll have a look at that today as well. So if you don't mind, if you can remove your top and just lay down, and I'll come over and we'll do some manual therapy while you're lying on your back, okay? Great. Okay, how are you doing there? You okay? Are you comfortable? Yeah? Good. Are you sure? Alright. If at any point you feel uncomfortable, just let me know and we can reposition you or make any adjustments that you need, okay? Alright. So I'm going to start by examining your neck and chest and a bit of your lower back as well. And just stay laying down, it's totally fine. We don't need to move from here. If I need to move you, I'll do that. In the meantime, just get comfortable and try to relax and just breathe with me, okay? Okay. So the first thing I'm going to do is just take a look at your neck and feel around there, see what's going on, and then feel your chest muscles as well, just to understand what's going on with the stiffness, alright? Okay, so I'm just gonna warm my hands a little bit to make sure it's not too much of a shock for you. Alright, can I place my hands on you, please? Thank you. Okay, so let's see, your shoulder here does feel quite stiff. Do you feel the stiffness there? How about on this side? Do you feel stiffness there too? Yeah, okay. Which side would you say is slightly worse? This side right here. Okay. Alright, let me see. Okay. Alright, I'm just going to reach behind your shoulder blades right here, okay? Just place my fingers there and pull a little bit upwards, okay? Alright. Yeah, now just stay where you are, no need to tense up. Alright. Okay. Then I'm going to place my hands on your neck, the back of your neck, and just move my fingers around in this fashion, alright, to understand how your muscles are positioned, and you let me know if there's any pain or sensations there, okay? Okay? How's that? Okay. Bit of pain? Whereabouts? On this side, just behind. Okay, we can work on that. I'm going to put my hands on your pectoral muscles, just on your upper chest here. And the reason for that is because these muscles are very strong, and the fascia, the connective tissue on top of these muscles, tends to be a lot stronger than the connective tissue on your back, okay? So what can happen is, if these muscles are stronger, or if they're contracted through sitting this way, okay, and rounding your shoulders or hunching down, what can happen is these muscles and the connective tissue in this area of your body can become contracted, and then it works to pull on the muscles on your back and stretch them, and then there's an imbalance between your chest and your back, and it can cause your back muscles and your shoulder blades to be sore, okay? So what I'm going to do is just place my hands here, and using the base of my palm, I'm just going to press and stretch the connective tissue from your chest outwards into your shoulder area. And you may feel it in particular around here, in the area where the shoulder connects to your body, alright? Okay, just going to place my hands on your chest, alright? Is that okay? Okay, now I'm just going to press. Do you feel that tension? And all the way out to the shoulder. Just breathe out with me. Okay, good. Let's do the other side. So breathe in. And I'm going to place my hand just here and press out. And when you feel that pressure, just breathe out with me, okay? Well done. Now I'm going to repeat that again, so just keep breathing as you have, okay? In and very good job. And then the other side here, and breathe out. Good, do you feel that? Alright, one more time on this side. Good job. And this side again. Good. Okay. Very good. Great. So the next thing I want to do is I want to work on the back of your neck. So what I'm going to do is make sure that we move your chin as close as possible to your chest. And I'm going to take my hands and rotate your head forward so that your chin and your chest come to touch. And I will just hold your head there for a few seconds. And what that's going to do is stretch the back of your neck and allow it to relax, alright? And you need to tell me when your limit is, okay? So if you feel any pain, please tell me and I'll stop. Otherwise, I'll pull a little bit more. Everybody's necks are different and our muscles have different leeway, so you need to tell me when to stop, okay? Okay, don't be shy. Alright, so I'm just gonna put my hands on the back of your head and just pull the top of your head down, alright? Good, okay. So let's do it. And how does that feel, okay? Good, okay. There? Okay, just breathe in and out. feels good. Excellent. This is something that you can ask somebody to do for you at home. It's a really easy stretch. The important thing is that your neck is entirely relaxed. You're not doing any movement yourself because it can strain your neck, okay? Our heads are quite heavy, so we need to get somebody else to come in and do it for you. Okay, should we do that one more time? Good, so let's go for it. Okay, and forward. You're a bit more flexible this time. Here. Okay, breathe in. And out. Breathe in. And your out breath, I'm going to give it a bit more of a tug. Good. And then all the way back down very gently. There we go. Are you comfortable? Great. Okay. So another thing I want to try and do is just to run my fingers on the back of your neck and really press in the back of your neck at the base of your head, of your skull, okay, where your skull connects to your spine. There tend to be quite tight muscles there that can influence the nerves that go down to our backs, and it can cause some shoulder blade pain as well, okay? So I'm just going to reach in there and just give you a bit of a massage, alright? Great, so I'll just be doing this motion and perhaps putting my knuckles a little bit in the base, the tips of my fingers quite strongly in the base of your head, alright? Okay, so just breathe as I do this. How does that feel? Good. Just lean in a little bit closer here, just so I can apply more pressure. You're doing really well. Well done. Okay. Just keep breathing for me. Okay. Okay, good. Is that okay? Good. Just keep breathing, please. And out. Great. Just keep your neck relaxed. No need to do anything. Okay, good. So I'm going to press just a little bit harder on this side, okay? Just breathe out with me. Good. And now I'm just going to put my fingers in the base of your neck and I'll just press, okay? Okay. Yeah, I know it's a bit of tension there. Breathe out. Good. Yeah, just stick through it. It's going to be worth it later. Excellent, excellent, good. Good, you're doing really well. Okay, out breath and we'll do it one more time. I know. It's for a greater good in the future, so a little bit of tension now, but we'll sort it out for you. Okay, one more time. And a bit of pressure. Good job. Okay. Alright, well, we've done a few stretches for you on your chest, on your neck, your shoulder blades. And what I'd like you to do as well is continue stretching the back of your neck at home using the stretch that we did by bringing your chin down. Okay, so again, please make sure you get somebody's help for that one. Now, in terms of the last stretch and pressure that I did, you can certainly do that at home just by placing your fingertips right here at the base of your neck and just press in. So if this is the area that you're pressing, you want to get underneath and curve your fingers and really press in there, okay? you need to press a little bit more than you think, just because it's the base of your skull, okay? And it's quite a strong area, so you don't need to be as tender as with some places with softer tissue. But again, don't overdo it. Like today, I hope you feel that you're kind of at the edge of your pain. You don't want to be in actual pain. So if you feel actual pain, to back off. Okay, so I'd like you to do this every other day for the next week, and then I'll see you again. And we're going to repeat these and see how you're doing. Now, like I said earlier, I have a good idea of what might be the cause of some of your pain, but we never know for sure until we see how the treatment is working. So please persist with this. Make sure you do it, okay? Remember to keep your shoulders down when you're sitting. No hunching down like this and keeping your shoulders up. Remind yourself to weigh them down as though you have weights here, okay? Between doing that, the neck stretch, and the pressure in the back of your neck, you should feel some improvement very soon. But next time you come back, we'll do some more treatment for you, okay? Wonderful. Alright. So I'll leave you to get dressed and call me when you need my assistance, alright?